Let's turn now in San Francisco at the ASA to another important topic likely to be tested by the board. As usual in this audio question and answer series, the governing keywords along with the text of this audio file will be in your Bible Central sources. In this case, Big Blue, Big Red, and Mocha Blue. So let's turn to a question, answer, explanation of interest today. A single best question, a modified released Mocha Minute question, which is, as is so often the case, applicable across many board battlefields. Certainly the basic, the advanced Part 1, and the Mocha examinations. The question reads as follows. Again, it's a single best. Why do patients with end-stage cirrhosis require an increased initial dose of a non-depolarizing muscle relaxant to establish paralysis? Why do patients with end-stage cirrhosis require an increased initial dose of a non-depolarizing muscle relaxant to establish paralysis? Is it A, altered drug binding to serum proteins, B, decreased hepatic clearance, C, increased volume of distribution, D, proliferation of acetylcholine receptors, or E, decreased number of acetylcholine receptors? Again, why do patients with end-stage cirrhosis require an increased initial dose of a non-depolarizing muscle relaxant to establish paralysis? Is it A, altered drug binding to serum proteins, B, decreased hepatic clearance, C, increased volume of distribution, D, proliferation of acetylcholine receptors, or E, decreased number of acetylcholine receptors? Good luck. Let's saddle up, lock and load, and attack this important subject, namely the altered dose of a non-depolarizer in the setting of cirrhosis and the mechanism of action for that. According to the ABA Horse's Mouth in this released modified Mocha Minute, quote, hepatic failure leads to an increase in volume of distribution of hydrophilic drugs, including neuromuscular blockers, leading to the requirement of a larger initial dose. Non-depolarizing muscle relaxants are highly ionized, I'm still quoting, water-soluble compounds at physiologic pH and possess limited lipid solubility. A delayed onset of action and requirement of a higher initial dose of non-depolarizing muscle relaxant occurs in patients with cirrhosis, secondary to an increased volume of distribution, which causes greater dilution of hydrophilic drugs. However, once the desired level of block has been achieved, subsequent recovery may be slower and the duration of action is prolonged, secondary to decreased hepatic clearance. Alterations in protein binding and reduced levels of albumin have no effect on the duration of action of non-depolarizing muscle relaxants. Continuing to quote, unlike patients with burn injuries or stroke, patients with cirrhosis do not develop upregulation of acetylcholine receptors. Close quote. Therefore, to summarize, patients with cirrhosis require larger initial doses of non-depolarizing neuromuscular relaxants due to increased volume of distribution of these agents. Unlike stroke or burn patients who experience upregulation and require higher initial doses of non-depolarizers secondary to that upregulation, cirrhotic patients require higher initial doses of non-depolarizers secondary again to increased volume of distribution. Best answer, therefore, putting this all together, is choice C. The Top Ranger t-shirt was easy to spot during our daily Ranger run. It's a quote which speaks to me especially strongly today in San Francisco. Episodes in life that last so many years in memory are often measured by fleeting moments as they happened. Having just landed in San Francisco, where I'll man the Dr. Jensen board prep booth. I'll hoist our proud colors and see many old friends while hoping to meet a few coming along. I especially like to go to the resident case poster presentations. It's fun to see the enthusiasm coupled with the excellence and the high hope for the future. It gives me a lot of hope, as well as instructing and refreshing my own synapses. 30 years ago, I attended my first ASA meeting here, and I went to the lectures and worked hard, at that time studying, like many of you today, to pass boards. I still remember a lot about that meeting and that time. Now it's just a fond and proud memory of a type you'll have someday, of the episodes that make up your preparation during this sometimes stressful and critical time in one's career. Keep up the fight. Good things are right up ahead for you. Farewell now from Ranger Camp tonight in San Francisco, and as always, onward now to victory.